Good morning, Dr. Chua. Hi, my name is Faezah binti Majais. I'm a master student. Today I'm going to run through the session 2. I will just go talk to, assuming that I'm talking to a patient. I will call this patient Miss A. Hi, Miss. My name is Faezah. For this session, I'm going to do some, we call it pain education session. It will be like a simple, like we call it chatting session. First, I was actually know that you are actually having a pain for already for 2 to 3 months. So this pain, normally you did not able to recall any. There is no incident of any participating event which lead to the problem that you have facing now. So basically, just to share with you, when we talk about pain, normally is when you have pain, normally there will be some mechanism. Okay, for example, if I knock my hand, I can feel the pain, then presented with some pain. But in your case, since you are not able to recall any incident that the predisposing factors, it could be, sometimes pain can our brain can actually getting a wrong impulse, or we call it signal, from the incident or the pain that we are having for few reasons. Okay, for example, let me share some story with you. There's a guy who's actually fall direct onto a nails, a nails. So when she fall direct into her nails, he actually wearing a boots. So the foot was actually like in this position. Okay, but assuming that the nail is going through the boots, it immediately caused the pain. He actually feeling that pain sensation. It was actually terribly big damage happening. But then when he open up the boot, try to open up the boot, the nail was actually in between. It was actually happen. There's no damaging occurs. The nail was actually in between the foot, the fingers. Okay, so this is where, like what I'm saying, trying to explain to you is, it's probably like the signal was sending to the brain that there was actually big damaging occurs. Okay, and which lead to the boy feeling pain, but which is not. So same goes to your problem, your condition, because there is no damaging or incident or happening occurs. I'm not saying that your pain is false, but it's just that the brain is actually adapting or taking a wrong impulse and sending back to your structure where you feel pain, and which is is actually there is no pain. Actually, you just feel it because of the brain is sending a wrong impulse to the area that you are feeling pain. That is one of the possibility. Okay, by understanding, like, if you know that we know that there is no damaging, I'm sure normally if we also have damaged area or injured area, it will take some time. It will give, like 3 to 4 6 to weeks or 12 weeks. There will be a duration, and plus if we do some together with assessment, we know that how long it will recover and the pain will off. So it's just that when sometimes, like in your case where you feel like 3 months, the pain become like independent, and it's not easy to get rid of it. But we can try to slowly do it. First, you must understand that there is no damaging area occurs for your condition. Okay, that is one. Second one, like because of this pain that you've been having, it could be it actually disturb your sleep quality. Okay, and probably, I'm not sure, maybe you can tell me whether you have any social interaction. Okay, and reduce in your physical activity because you are feeling the pain. Okay, but by understanding in the beginning there's no pain occurs, and you know that if we get rid of slowly, not to think about the pain, and try to slowly do your functional activities normally, I hope it will actually helps in reducing your problem. Okay, and the third one is like coping skill. I want to know, maybe you can share with me on your how you cope with your pain, that we can actually try to help you to do some intervention later on, and to see how you can actually cope with your pain better. Okay, so which is I will teach you later. Okay, so for now, for this pain education, I hope you understand. I need you to understand well that you don't have any incident, there is no damaging. By understanding that, I hope we can actually slowly sending the right impulse to the brain. Okay, by coping it well, okay, with through some intervention that I'm going to teach you. A few things that you can do is, for example, exercise will be one of the good treatment, whereby you can actually increase your physical activity. For example, we start with probably brisk walking to general health. Okay, and because now if you're having pain, probably you just sitting down, not doing any, so you can actually doing some brisk walking and then some mobilizing within pain limit, because movement will help you to feel better, ease, and you can actually, for example, if you can move the next little range, you can actually later on you can move more. You can just do it gradually until you get more. Okay, and that is one. The second one is you can do is we can do hot pack. If you have at home, you have hot pack, you can put hot pack at the area that you feel pain, because you feel release on the area. Normally you put it on behind your neck and also your shoulder. All right, on top of that, you can combine with some mobilizing exercises together. You can do it this for 2 to 3 times a day, and also it can be repeatedly. We'll try to see for 1 or 2 weeks and see how it goes. Okay, all right. The third one is you can do massage. Okay, have you done massage before? Maybe massage will actually help if you don't unable to go outside. Maybe you can just do some pressing and release. Okay, like in this circular movement. Okay, this is what now I normally do if I feel like stretch. Okay, and also on top of the exercise, you can do massage, and in combination, you can do some stretching. Okay, stretching of your movement. Okay, stretch. You can hold for stretching for between 15 seconds to 30 seconds. Start with 15 seconds first, because stretching can help to release the area that you feel probably like spasm. Okay, and massage, if it will be good. Based on my numbers of patients that I have, you can actually go do it. I will recommend you to do full body massage, because sometimes even though you have feeling pain at the neck, it can be related to the whole structure of the body. So make the body relax. Okay, this will be one of the good things. We can start with 2 times a week for the massage. And the next one is, I think the best is to, if you are not feeling based on your activity, breathing exercise will be a good technique. Okay, just breathe in through your nose, hold for 3 to 5 seconds, breathe out through your mouth. Normally it will help you to ease. Okay, I will prefer to do, you can do in any position, but normally in sitting down in lying position will be a very good whereby you can actually relax the whole body. Okay, and do the breathing for probably 2 to 3 times. Okay, if you whenever you feel that your pain increase, this will actually help you to cope with the pain better. Okay, I hope I'm teaching you some of the intervention that we can actually do, and we plan to do during our session. And just the key point, it's very good to understand that by understanding that if there is no damaging on the area or mechanism, normally there is no damaging tissue, which not a true cause of pain. So just for today, just get the idea, and hopefully we'll see the next session, and we'll see how it goes with the understanding that you have, and also some information that you can continue at home on your own. Thank you.